Hello, everyone. I am Congresswoman Pramila Jayapal, and I'm so proud to represent Washington's 7th Congressional District in the U.S. House of Representatives, to serve as the co-chair of the Congressional Progressive Caucus, and very proud indeed to be the lead sponsor of H.R. 1384, the Medicare for All Act of 2019. I am so sorry that I can't join you in person, but I'm grateful to have the opportunity to address you by video, really to say thank you for everything that you've done. Because of your tireless organizing and mobilizing, we are witnessing a shift in the national conversation on healthcare. The fact is that most Americans are tired of our broken system. Every day, regular folks feel the impact of our for-profit healthcare system that puts profits over patients. This is a national crisis people are feeling when they are forced to decide between paying for their insulin or paying for their rent. They feel it when they have to file for bankruptcy because they get an enormous surprise billing from an out-of-network doctor or hospital. They see it in their stagnating wages and skyrocketing private insurance premiums, copays, and deductibles. Today in America, we spend almost double what every other industrialized country in the world spends on healthcare. And yet, we still have 70 million people who are uninsured or underinsured, and tens of millions more who simply cannot afford to pay for their healthcare, even when they have insurance. We have the highest maternal mortality rates, that's moms dying in childbirth, and we have the highest infant mortality rates. That's babies dying young, of all of our peer countries. We have the lowest life expectancy of our peer countries. So why is it that other major countries can guarantee universal health care for half the cost as America, and we can't? It comes down to the profit-making motives that are baked into our system, a system that grows more and more costly every single day because of administrative waste and enormous CEO salaries. GoFundMe has become the most popular insurance plan, and people are dying because they can't afford their health care. I believe that the only way to transform our system, to expand coverage, to be universal, and to contain costs is through a single-payer Medicare for All system. And that's why I'm so proud to have introduced the most progressive Medicare for All bill in the history of the House, a bill that for the first time lays out a comprehensive and detailed proposal of a healthcare system based on patients, not profits, a healthcare system where everyone is in and no one is out, a healthcare system that recognizes the fundamental truth that healthcare is a human right, not a privilege only available to the wealthiest few. Today, my Medicare for All bill has the support of the majority of the Democratic caucus, 119 co-sponsors, and we have had the first historic hearings ever in the history of our House. Those have come in the Rules Committee, the Budget Committee, and the Ways and Means Committee. And I've also been told that we will have a hearing in Energy and Commerce, and we are working to see if we can have a hearing on small businesses and Medicare for All. All of this momentum has made Medicare for All a defining issue of the 2020 election. One of the biggest tasks is to push back on the myths coming out of the presidential debates, on our own Democratic side and from mainstream TV anchors who have already decided that Medicare for All is some sort of an unachievable pipe dream. Well, I'm here to tell you, because of this coalition and so many others across the country, nothing could be further from the truth. We are winning, and it's because of you. Thanks to you, we have built the largest labor coalition in the history of Medicare for All, with 32 major labor unions who have endorsed the bill, including SEIU, AFT, NEA, UAW, and many more. You see, labor brothers and sisters understand two critically important things. First, that stagnating wages of workers are tied directly to rising healthcare costs. If you've only got $1 to bargain at the bargaining table and 60 cents of that has to go to healthcare, that means only 40 cents goes to wages, and that's a huge problem. We've just seen how 50,000 courageous UAW workers are on strike in part because of rising healthcare costs, with news just out about a possible tentative agreement about to be voted soon. And we've seen how employers can cut healthcare in a strike situation as a threat and bargaining leverage. Second, I know that you all understand the need for solidarity for all those workers who are completely uninsured across the country. You understand that a healthcare injury to one is a healthcare injury to all. We need your continued organizing and leadership to educate people about labor's strong support and commitment to enacting Medicare for all. We need your continued organizing to bring on board more unions and to educate your own members. So as you gather in Portland, let me just say once again, thank you. I could not ask for better healthcare comrades. Together, let's make Medicare for all a reality.